morning again, guys. This is day 7, Heart Talk and Failure Types. We're going to be looking at pages 303 through 309 to the end of the chapter here. Part 3, Heart Talk, clinical terms and so on. Last day, we went through the beginning of the functions of the heart, autonomic nerve innervation of the heart, the cardiac cycle, and so on. We're going to look at Heart Talk clinical terms, starting on page 303 of the old textbook. So to start with, there are some terms that we're going to pull up. See, I can get my PowerPoint up. There we go. Some terms that we are going to look at here. They got a little diagram similar to the one on page 304 that you guys have to download. End diastolic volume, or what's called EDV, is also termed as preload. So if you look at dissect that whole term, the end of the diastolic phase, so at the end of the relaxation phase, that is the volume of blood that is contained within the atriums and the ventricles, the whole volume inside the heart. Now, the ventricle fills with blood during diastole. EDV determines how much ventricle is stretched and the basis of Starling's law of the heart. So as physical activity increases, as stress increases, increase in venous return to the right side will also increase return through the lungs to the left side of the heart. So end diastolic volume can be increased. As that end diastolic volume increases, it stretches the ventricles. And remember that Starling's law of the heart we spoke about yesterday. As the ventricular myocardial tissues are stretched, they will contract harder to increase the ejection fraction, thereby increasing the cardiac output overall. End diastolic volume, preload. The amount of blood in the ventricles at the end of diastole, it's the same as the end diastolic volume, okay? More stretch, more contraction. Ejection fraction, I've used that term a few times already in the discussions here. Ejection fraction is essentially the volume of blood that is ejected from the blood during systole, or the percent based on a percentage. Okay, so a healthy heart sitting there at rest, 68%. A very healthy heart can increase it to up to 90% with exercise. If you're undergoing cardiovascular exercise, your heart can become a lot more efficient. A weakening, failing heart characterized by a decrease in ejection fraction, maybe as low as 30%. And these are the people that are undergoing heart failure and so on. Thickening of the heart tissues, the myocardium becomes hypertrophed, a number of other issues. Okay, afterload. Okay, afterload is this little guy over here who's squeezing the vessel coming out of the heart. Now, afterload is essentially the resistance to blood flow in the arteries and vessels as the heart is pumping it. So you have back pressure from the lungs pushing on the right side of the heart. It's resisting the flow of blood from the right ventricle out to the lungs. What would cause this to increase? A lifetime of smoking, exposure to toxic gases in a hazardous work environment, lung disease, cystic fibrosis, etc. These things will cause, well, specifically smoking. Well, let's just look at that. Smoking will cause a hardening of the alveoli and the lung tissues, thereby decreasing the elasticity and flexibility of the pulmonary capillaries. And as those pulmonary capillaries decrease in their flexibility, there is more resistance to blood flowing through them. So what that does is it makes the right side of the heart work harder. It increases the effort that the right side of the heart has to do. Now, remember that when we start talking about right-sided and left-sided heart failure, that's going to be important. The other side of the heart, the left side, which delivers blood out to the systemic circulation, if you can imagine, you've all heard the term, you are what you eat. Your body is exactly that. If we have a high-fat diet, if we have a genetic predisposition to atherosclerosis, which is a fatty plaque buildup within our arterial circulation, we basically deposit on our blood vessels surface whatever we put in our mouths. If we're constantly eating saturated fats, if we're constantly having high cholesterol, high fat diets, we are going to deposit that fatty material on our vessels. As that fat deposit is built up, our vessels can no longer contract and dilate as necessary to regulate blood pressure, and it decreases the lumen size, or the opening within the blood vessels. It also decreases the amount of volume that the blood vessels can transport. efficiently. So what happens is that resistance is like two little fingers squeezing that hose, whether it's all throughout the arterial circulation or just in a couple of little narrowed spots. That creates a back pressure, and that back pressure has to be overcome before blood can flow out of the left ventricle. That left ventricle then has to work harder as the afterload increases, leading to a hypertrophy of the left ventricular myocardial tissues and an enlarging of that heart decreases its efficiency. Again, the ejection fraction drops off, so the heart again has to work harder. So you end up running into this whole death spiral of having to work harder to overcome the blockage. Working harder causes the muscle to get bigger. Muscle getting bigger decreases the percentage of ejection fraction, so the heart has to work harder to maintain just a status quo. So yeah, it's not a good thing. So when we look at all of this, these volumes are really what we develop. The afterload is what develops as we get older, depending on how we take care of ourselves. Now on page 305, we go over inotrophic, chronotrophic, and dromotrophic effect. I'll review them, but we talked about them in a little bit more detail yesterday. Inotrophic effect refers to the change in myocardial contraction that is not due to stretch. That is the contractile force caused by the sympathetic nervous system. The sympathetic nervous system causes the ventricular myocardial fibers in the ventricles to contract harder, increasing their contractile force, increasing the ejection fraction. There is no parasympathetic effect on the inotrophic effect, so there's only a positive inotrophic effect. Chronotrophic, that has to do with speed. A chronograph it measures time, okay? Chrono refers to measurement of something, and a chronotrophic really is the heart rate. Again, a positive chronotrophic effect increases the heart rate, and there again, that's the sympathetic nervous system. A negative chronotrophic effect is the parasympathetic, your brake pedal, and that will slow down our heart rate at the sinoatrial node. Dromotrophic effect changes the speed at which the cardiac impulse passes through the atrioventricular node, and again, the sympathetic nervous system will speed that up, it'll shorten the time up, and the parasympathetic will extend that time and slow the heart down, decreasing ejection fraction. Now the heart talk receptor language, I wasn't worried about you guys reading that. If you want to, go right ahead. I'm not going to test you on it. A little bit more in depth. Flipping the page over to 306, 307 here, looking at part C, the failing heart when the heart can't pump. So there are a couple of different types of heart failure. If any of us have an older relative, grandparents, aunts, uncles, etc., that are undergoing heart failure, this is essentially what's happening. With left-sided heart failure, blood pumps the left ventricle pumps blood into the aorta. Two things will happen. Blood will back up into the lungs, and the heart is unable to pump a sufficient amount of blood into the systemic circulation. Now, looking at afterload, if the afterload becomes too great for the left ventricle to overcome, okay, the right side is still pushing blood out to the lungs. That blood will increase what's called the pulmonic pressure, and it'll actually cause fluid to move from our circulatory system through the alveoli and into the lungs. Rather than just the oxygen and carbon dioxide moving, the pressure will become so high that fluid will actually move into the lungs, and they will develop what's called pulmonary edema. And fluid in the lungs is never a good thing. These patients, the left side of their heart, the muscle has become so large that it can no longer sufficiently pump blood out in the volumes necessary for circulation. In extreme cases, this left-sided heart failure will eventually cause death. Okay, so a backward failure. The blood backs up into the structures behind the left ventricle, i.e. the left atrium, pulmonary veins, and most importantly, the pulmonary arteries. That pooled blood increases pressure in the pulmonary capillaries, forces fluid into the lungs. Not a good thing. Pulmonary edema, or the buildup of fluid in the lungs, causes shortness of breath, cyanosis, or a bluish coloration, because if the alveoli are full of fluid from your circulatory system, they don't have space to absorb oxygen from that circulatory fluid, the blood. Okay, so treatment is listed there. We're not going to even talk about treatment, but a left-sided heart failure backs up blood into the lungs. Patient will be cyanotic. They'll be short of breath, and they will have gurgling respirations when you listen to their lungs. Now, what's also called a forward failure component to the left heart failure. Damaged left ventricle cannot pump adequate blood to the systemic circulation. The oxygen, the organs of the body receive inadequate oxygen. Decreased cardiac output causes other signs and symptoms like the kidneys will filter less water. The kidneys will also absorb less salt and water, causing an increase in blood volume. So you have additional edema formation within the body. You end up with what's called pitting edema. Heart begins to show wear and tear, continuous excessive sympathetic activity, because the heart is being stimulated so much with the sympathetic nervous system to try to increase cardiac output. And it's like pushing on the gas pedal when it's already on the floor. You just can't get any more out of it. What usually causes left heart to fail? Two common occurrences are a myocardial infarction, which is a heart attack, and chronic hypertension. And this is why high blood pressure, which is the common name for hypertension, is bad. Chronic hypertension, or because of a lifestyle of lack of physical exercise and diet. Biggest thing we can control is diet. High blood pressure causes the left heart to constantly work hard, and that constant hard work causes the hypertrophying of the heart muscle, like I was saying. Okay, right-sided heart failure. When the right ventricle fails, the blood backs up into the veins, and that return blood will end up pushing its way out into the interstitial tissues in the lower extremities, causing what's called pitting edema. The best way I can describe this is if you have memory foam, you know how memory foam acts. You push your finger into it, you let it go, and it slowly refills. If you do this to a patient in the ankle area or lower extremities, if they have right-sided heart failure, they will have this pitting edema where they have puffy legs. You push your finger into the leg and it doesn't automatically rebound like muscle or fat tissue does. It will push out of the way, and then when you take your finger away, it will slowly fill up, and that is actually pushing fluid away from where your finger was, and that fluid slowly filling back in causes the memory foam action. That's called pitting edema, and it's one of the things that we're going to be looking for when we start doing our assessments in the next course here. It can also cause an enlargement of the liver, because the liver filters a high percentage of our blood coming out of the aorta, the descending aorta, and then back into our inferior vena cava. If the inferior vena cava isn't taking the blood, or if the right side of the heart isn't taking the blood fast enough, it will actually build up back pressure and cause excessive pressure within the liver, causing it to enlarge. Also, the jugular veins on either side of the patient's neck will be distended and will actually be pulsating. You can see a person's pulse no, actually you can't see their pulse in that. The distended neck veins, yeah, you know what, you can sometimes see the pulse if they're extremely distended. The jugular vein distension is essentially the return pipes from the brain, draining the blood back down into the right atrium. And every time the right atrium takes blood, those veins will drain a bit, and then when they close to undergo a contraction, the blood will build back up into those jugular veins. A distended jugular vein indicates right-sided heart failure. The blood is basically backed up into the brain and can't return fast enough. Now, right-sided activity, again, this can be caused by smoking, by exposure to toxic chemicals, basically an impairment of the lungs, or of the ability of the blood to flow through the pulmonary capillaries, is what causes the right side to have to work hard, and that overworked right side starts to fail. Again, it becomes hypertrophic. It starts to fail in its ability to push blood through the lungs because it's worked so hard. A couple of other signs are the pitting edema, the enlarged liver, jugular vein distension are signs of that right-sided heart failure. Okay, so have a look at the sum it up sections there, the disorders of the heart sections. As you age, these are all good pieces of information. In as far as the instruction for this chapter, that is the functions of the heart. I'd like you to have a look at page vocabulary quiz tomorrow, no page of reading. Your assignment is the old study guide, page 187 through 188. There's some matching questions there. You have a vocab quiz tomorrow on the vocab up to date here. That's day 8. And after that, we are moving on to page 330 and page 335. We're going to have a quick look at the function of the blood vessels. We're going to look at a little bit about blood pressure, some components, and so on. And yeah, we'll pick up after that on day 9. So the end of day 7. You guys have a great day, and we'll talk to you soon.